This is Dr. Selene Parekh, the Fantasy Doctor. Mumps continues to ravage the NHL. The Hockey League is seeing player after player, week after week, getting afflicted with mumps. Mumps is a viral infection of the glands that produce saliva, kind of the glands on either side of the jaw, and it can become very painful for eating and swallowing. Now, it starts off usually with fever and headaches, but it can also lead to very tired behavior and a difficulty of eating. It can become very painful as well. Now, the biggest problem for the NHL is that you can have mumps and have no symptoms for about 6 to 12 days before you start having symptoms, and for about 9 days after you show symptoms. So the problem becomes, how do you control mumps? Now, mumps is transferred from one person to the other through saliva. So you can imagine that if the players are coughing or sneezing on the ice, these small particles, the droplets, can get into the air and then can infect other players. Most U.S. athletes have been treated with a vaccine for mumps when they were kids, and that has them covered. But the coverage for players outside the U.S. is a little bit more questionable. This is Dr. Selene Parekh, the Fantasy Doctor.